Doctor, I'm bleeding while I'm on the combined pill. What should I do? Well, if you're bleeding while you're on the combined pill, let's assume you've been taking this pill for 2 to 3 months and you're still bleeding, it could be that the pill has disrupted your hormonal balance to cause bleeding. So it might mean change of the pill to an alternative pill or an alternative form of contraception, such as taking the mirena coil, the injections, or the implants. Also, you want to check that the bleeding is not related to a vaginal infection, for example, or cervical infection or polyps. So you need a vaginal examination as well as a cervical examination to check for this. We always advise that anyone with bleeding should have an up-to-date cervical smear. So your doctor or nurse might want to do a smear while examining your area. I would also advise for you to have a pelvic scan to see if the bleeding is coming from the uterus, as you can also have polyps in the uterus. And it's also important to check the lining of the womb using a scan, because if you've got a thick endometrium, which is the lining of the womb, that can also cause bleeding, especially if you're taking the pill back to back, because taking the pill back to back would cause the lining of the endometrium to build up and can cause bleeding at unsuspected times, and can cause bleeding to be prolonged, or you can have an irregular pattern to your bleeding. I would also advise for you to have blood tests to check for your clotting factors, because if you've got abnormal clotting factors, which is responsible for controlling the amount and duration of your bleeding, this can also cause prolonged bleeding, as well as checking your full blood count to make sure you're not anemic, and checking your thyroid function test. Your thyroid is a gland which controls how the body's metabolism works, and if your thyroid is abnormal, that can also cause abnormal vaginal bleeding. So it is important to get fully investigated to find out what the causes of bleeding are.